You've almost certainly seen this happen, right? A doctor at a checkup wrapping a simple measuring tape around a baby's head. It looks so routine, so normal. But that one little measurement, it's actually a critical window into how a child's brain is developing. So today, we're going to get into microcephaly, what it is, what it means, and why that one measurement is so important. Yeah, if you're a parent, this scene is going to be super familiar. You're in the pediatrician's office, they whip out the measuring tape. It feels like just another box to tick on the checkup list. But have you ever stopped to wonder, what are they really looking for with that number? Well, it turns out that simple measurement is unbelievably important. It's one of the best direct windows we have into brain growth. And when that measurement comes back a lot smaller than expected, well, that's when doctors start using the term microcephaly. Think of it as a really key signal, an indicator of a child's neurological health. Okay, so what exactly is it? To put it simply, microcephaly is just the medical term for when a baby's head is significantly smaller than what's typical for their age and sex. And we're not talking about just a little bit smaller. There's a very specific clinical line that doctors are looking for. So what is that line? What's the threshold? Well, doctors officially make the diagnosis when a child's head circumference drops below the second centile on a standard growth chart. Now, I know second centile sounds super technical and kind of abstract, so what does that actually mean in plain English? It's actually pretty straightforward when you break it down. It means the child's head is smaller than 98% of other children of the very same age and sex. So imagine a room with 100 babies. Their head would be smaller than 98 of them. And that's why this measurement is so critical. It's a huge statistical flag that something might need a closer look, because head size and brain growth are just so tightly connected, especially in those first couple of years. Right, but getting a diagnosis of microcephaly, that's not the end of the story, not at all. It's really the start of an investigation. You see, it's a sign, not a disease in and of itself, and it can point to this whole complex web of different causes. It's almost never just one simple thing. So for starters, the causes can be genetic or even structural. We're talking about things like known genetic syndromes or a condition called craniosynostosis. That's a mouthful, I know, but it's basically when the soft plates of a baby's skull fuse together way too early. It creates this kind of rigid box that literally stops the brain from having room to grow. And you know, even certain metabolic disorders can be a piece of the puzzle here.
Then you've got congenital infections. These are infections that can pass from the mother to the baby during pregnancy. When a virus manages to cross the placenta, it can unfortunately go on to attack and really disrupt the baby's developing brain tissue. The Zika virus is probably the most famous recent example you've heard about, but actually much more common viruses like cytomegalovirus or CMV are also known causes.
And it's not just about what happens in the womb. The environment plays a huge role too. This could be prenatal exposure to things like alcohol, leading to fetal alcohol spectrum disorder. But, and this is important, the environment after birth matters just as much. Things like severe neglect or serious long-term malnutrition, what doctors call faltering growth, can literally starve the brain of the stimulation and the food it needs to grow the way it's supposed to. Finally, there's what's called acquired microcephaly. This basically means the brain started out developing just fine, but then something happened. It got damaged. This could be from a lack of oxygen during birth, a condition known as perinatal asphyxia, or even from something like dangerously low blood sugar. And severe infections that happen in early infancy, like meningitis, can cause inflammation that damages brain tissue and just stops its growth in its tracks.
But, and this is a really important point, sometimes a small head is just a small head. It can totally be a normal family trait. You know, if both parents have smaller heads and the child is developing perfectly, hitting all their milestones right on time, it might just be a harmless genetic variation. Nothing more.
Okay, so that brings us to the big question, right? Why does this one measurement matter so much? When it does signal an underlying issue, what's the actual clinical impact? What does it mean for the child?
Well, because brain size is so closely linked to brain function, a smaller brain often means there's just less physical hardware, less capacity for all the complex tasks it needs to do. And that's why microcephaly is often associated with some pretty significant challenges, things like cerebral palsy that affects motor control, intellectual impairments, developmental delays, and even a higher risk for seizures. And the clinical research on this is really clear. It absolutely confirms this link. In fact, this one quote kind of sums it all up perfectly. Poor head growth is associated with significant motor and cognitive impairment. It just goes to show you why that simple tape measurement is treated like a vital sign for the brain's health. So let's just tie this all together. You can really think of it as a clear three-step process. First, doctors measure. They measure the head circumference because it's a vital sign for the brain. Second, if that measurement is small, they investigate. They dig into that whole web of possible causes. And third, they work to understand. Understand the potential developmental challenges that might lie ahead, which is so crucial for getting early intervention and support in place.
It really leaves you with a pretty remarkable thought, doesn't it? In the incredibly complex world of medicine, how can one simple action, just wrapping a tape measure around a baby's head, tell us so much about the developing brain? It's a powerful reminder, really, that sometimes the simplest observations can unlock the most profound insights. Thanks for joining us for this explainer.